All right, says we're live. Melissa, which beach are you joining us from?
I am in Atlantic City, so New Jersey's oldest beach, where all the gambling started. So yay me! I do not gamble. I
Paradise.
just hang out at the beach.
Yeah, is this one of your like weird timeshare maneuvers?
Yeah, it's a
Okay.
timeshare. I get to just like hang out on the beach and like drink and not have to worry about gambling. It's the only resort on the beach that does not actually, in fact, have a casino.
Oh, okay. All right.
Is that
all
because
right.
you're
Well, good.
banned from the other casinos? Like, did they have like a picture of your face that's like, do not let this woman in?
I mean, maybe in a previous lifetime, but the past 10 years or so, I've been pretty good. So I don't think
Fair enough. Fair enough.
That's awesome. Oh my goodness. All right. Well, Melissa, who's joining us today? Because we're still recovering from the mind virus. So we had to get extracted from our brains from Madison, Wisconsin, or Verona. So we have some real guests on, which will help us continue to do that.
Okay. Yeah. So we have our returning guest from Gallon Growth, Julian DeSaliberry, the founder and CEO, and Sarah, I apologize, Schmattenberg, head of data and analytics.
Schmattenberg.
Thank you. I appreciate it. For Europe and the USA, Julian will be sharing insights from his team's recent report on global digital health trends, including a critique of the ROC Health analysis. Sarah, as lead author of the Gallon Growth's latest report, will provide us with key facts and figures on the digital health landscape. And of course, joining us as our favorite unpaid special correspondent, Michael Marchant, who is currently in transition to Sutter Health, but remains dedicated to the Freedom Health Data Network. So looking forward to this great show today.
Awesome. And we
are all unpaid. I realize that he is also unpaid.
We make no money.
We don't, but like, I just wanted to make sure that I because, that's how we intro him all the time. So I wanted to make sure that I added
just keeping it real.
Yeah. Just doing the thing.
Keep it real.
Yeah. To be clear, it costs money to be on this show, be one of us. So, that's cool. All right, man. Melissa, we'll take you off here and we'll do the news show that is less put together than usual. Let me just say that. So Lisa and I, we got back from, we got to go to the Epic user group meeting. We did a live show on Tuesday. It was totally weird. No one has told us that we're banned from Madison, but maybe we are. We don't know. But I feel like we didn't piss anyone off too badly. But here's some things that we saw. Lisa petting goats.
So first of all,
so many goats.
Obviously, I know this is part of the Epic story is like being on a farm and all this stuff. But let me tell you, I love a petting zoo, and I love farms, and I love goats, and the miniature donkeys that were there too. They got me with that one. I am into it.
Yeah, that was when we knew the mind virus took hold with Lisa. She was like, "Can we go back to the petting zoo?" And yes, we did.
I would like to see the petting zoo, and it was amazing. And I don't regret that part at all.
Yeah, the zebra was there too. There was a zebra in the petting zoo. Just in case anyone wants to know what this is really all about, there were zebras. There were slides, and there were also.
Stop going so quickly through the pictures because this is an important picture. This
the
is
zebra
going down a slide. No, this is cat going down the slide.
Oh, this is me shooting out of a slide onto my back on the floor. This is like a live action photo. So here we are. That was also apparently our friend Alia Suleiman, who's now at Datavant. Congratulations to Alia for that move. I think she's like chief privacy officer, chief counsel, chief a lot of things. She formerly worked at Epic and told us when she saw this photo that this is the slide she took to sushi lunch. And she had a good time doing that. So good for her. But this is a weird place, y'all.
The zebra is from Nebraska, I was told. He is not a permanent feature on the farm, on the actual Epic farm, but he is from some kind of zebra farm situation in Nebraska, which is very odd. And that was strange.
Yeah, the zebra was imported. So, whatever. We'll see if the zebra's there next year. Here I am. I was not injured. Also, apparently, during the UGM, there was Oracle made the interesting decision to wrap cars and drive them around Madison. So here is a photo of this, as well as another photo of the Oracle cars. I personally, Lisa, would not have spent money on this if I was in charge of Oracle marketing.
Listen,
Just
I
saying.
get they were trying to be cute and everything, and like they're like, "Ooh, we're gonna do a guerrilla marketing campaign during Epic UGM by like wrapping some cars in Madison or Verona or wherever." And I understand that it wasn't super effective, and also this argument, like, I'm
The
not
message
sure
is bad. The message is dumb.
it's not a meaningful argument here. I'm not sure people could say Epic is really unsafe with data. That sounds like a real stretch. Like, not what I would have chosen, not the smartest marketing campaign. Weird.
Yeah, I wonder if this was like, I don't know how things work at Oracle, but like this is one of those things I imagine where like your marketing team or everybody is super scared to like say something that is contrary to the opinion of the room. This is like groupthink. This is marketing groupthink. And I think some poor marketing staff was probably like, this is a real dumb idea, but they told me to do it. So I'm going to do it. And I'm going to make it look to all of these CIOs and CEOs of all these major health systems that are coming into Madison and be like, oh, your data's not safe. Like, that's like got to be the dumbest marketing spend I've ever seen in my life.
It's just
So
it's not good. And also, like, I'm sure
anyway.
they were afraid to say things that they could also be accused of. Like, nobody's hands are clean in the wonderful world of healthcare IT. And like, yeah, what are you going to say if you're Oracle, like this massive company? You're just like throwing darts at another massive company. I mean, what are you going to say that's not going to be a risk for you as well?
I don't know. I will just tell you, Oracle marketing employees, the reason you may not get a raise this year is because it was all spent on wrapping cars in Madison. So blame yourselves. Blame yourselves.
Amazing.
All right. Oh, yeah. Okay. More news about our body parts. So, Lisa, you sent me this article. It seems super exciting because I am, in fact, getting an IUD again. So I can live document this process for you all and tell you if it hurts. Because I'll tell you the first time it didn't. The first time it didn't.
Yeah.
I didn't feel shit. And then I even pulled it out by myself, as everybody knows, and I didn't feel that either. So either my cervix is dead or I'm one of the few women out there who are causing a lot of pain for other women because I'm like, oh, I didn't feel that. So, I don't know.
Yeah,
I don't know what's gonna
first
happen.
of all, you're of a very hardy stock, as we know. And I think that might be part of it. You're just a tough hay bale hauling sort of whatever. Keep going from there. But no, it's actually not.
Got the farm stock.
Her family literally runs a hay farm. I'm not making that part up, just to be totally clear. That is real.
Yeah.
So you're very hardy, high pain tolerance. Good for you. Not everybody is. This is actually a really interesting article. We'll probably link it somewhere because they're referencing a new device company. I think it's Swiss, actually, our Swiss friends. Yep, this is nodding. We'll talk about it in a minute with them, which has created a new device that is not the like really crazy like metal like stab thing, but in fact uses suction to like hold open your cervix to insert the IUD. That's I'm liking that I'm doing the hand movements. I don't know what that's about, but whatever. And so there's actually like a device innovation that will very likely help with pain. And what this article is saying is like, yeah, sure, like you can put some lidocaine in there, but that's not going to solve the problem. There are these real problems with the devices and the procedures that are used to insert IUDs. So good stuff, right? Like innovation. This is a real innovation story. Yeah.
It is exciting. We'll see. It might hurt like hell this time. I did get the copper one. Now I'm getting the hormonal one. And as everybody knows, I'm doing this because I'm very worried that we will have banned birth control in the Great Free South. So, I got to get things taken care of. Just got to get something put up there that no one can get out. So, I'm working on it. But yeah, they actually did not offer me lidocaine. They said take 800 milligrams of
take some ibuprofen, baby.
Listen, Lisa, I'm gonna do it. And I just scheduled it. I'm gonna get it done like 3 hours before the Health Tech Talk Show. So I will have all pain vividly in my mind if it does in fact happen. So anyway, moving on.
That's great.
Okay, this is another funny Epic thing. I posted it on our little Slack channel with Melissa, Lisa. This is crazy. I just post this because I think it's crazy people, and we went to Epic. Apparently this Newsmax, like super real conservative show is accusing Epic of helping to sign up illegal immigrants for voter registrations, which I have to all I want to say about this is, do y'all not have enough other crazy shit to cover that you are covering a back end provider EHR and how it might let illegal immigrants sway the election. Like, you got to be fucking kidding me. Like, I'm into crazy stuff. I just have to say, this is so dumb.
This is a stretch. This is a stretch. Is all I can say.
Oh my
You know,
God.
I don't think that. I don't think this is a big problem, but who knows?
Yeah. Anyway, interesting story. And this was taken from the world famous Hot Sheets His Talk. Exciting thing. TruePill got acquired. They got acquired by an Irish company, and apparently they got acquired because both companies are losing lots of money, and they're hoping together they will lose less money. But it is a shame because TruePill was once a unicorn, and now it is clearly not.
Yeah.
And it was only the deal was $525 million, but only $25 million in cash.
Right.
So.
Right. So not a lot of money exchanging hands there for that value.
No, not a lot of money, but exciting nonetheless. Love it when companies get acquired. Big fan. Lisa, I saw this and I was excited, not because, I did. I thought, well, Lisa needs so many more of these COVID tests. I will get the free 4 ones that they're giving again, and I will bring them to you since we don't use them down here in Georgia.
Thank you.
But I thought you might need them. But I'm excited. So yeah, so this is this program is being restarted. Many of you probably remember going to the little website and getting your free COVID test. They're going to give us 4 more. I neglected to see if that was lifetime or just this year, but I love free things. So you too, fellow Americans, can get 4 free COVID tests.
Let me take this opportunity to do my typical PSA. Everyone, there's a new COVID vaccine coming very soon. It'll be out very, very soon in the US. And it's totally worth your time to get your yearly update. Just like the flu shot, you can get a COVID vaccine. You can get them at the same time. You can get them in the same vaccine now. It's amazing. This fall, September and October, recommend October if you're reasonably healthy and reasonably young. Get your vaccine. You can do it. I believe in you.
You can do it. You can totally do it. I'm here for it. Also, I can't remember if it was in Politico or Axios or something, but there was a survey that 1/3 of Americans believe COVID is still bad, but most of America now says it's better to get COVID than the flu. So, I guess as usual.
Doesn't really hold up to rational thinking, but that's fine. You know what? You can solve this for yourself by getting a COVID vaccine and a flu vaccine at the same time at CVS, Walgreens, Walmart, Target, Costco, wherever you get those vaccines. It's free for most people. The vast majority.
While you're getting your IUD inserted, I bet too. I bet you
get your COVID vaccine, get your flu shot. Just get it all. This fall is a great time to re-up.
Mm-hmm. Yeah. Anyway, and also get your 4 free COVID tests. I think that sounds great.
And get your 4 free COVID.
Okay, so Lisa, we've been talking about these non-competes. I mean, I was pretty excited because in general, I'm anti-rules and did not like non-competes as a general standard. But even more exciting for a while was for our doctor friends. They were really unable to start their own practices, like anything competitive within a certain radius. Like their non-competes really sucked. And so this was actually a big deal to have them banned for our great clinician followers. We have so many. We have like 1 million fans who are clinicians, but that got overturned.
Yes, I mean, I think that's ridiculous, but let's hopefully they can make some improvements at the state level, but yikes.
Yeah, so this is going to be just like me being concerned about my birth control being banned in Georgia. Now we're going to do some state-by-state non-compete stuff. So, God bless the states. God bless the states.
Back to the
anyway,
states.
Kind of a bummer. Yeah,
as
kind
always.
of a bummer. This is always exciting just because I always think it's exciting when health plans don't pay people. This was, and the reason I want to say this is because God bless the media. There is a medical group in Florida that accused, I think, the Sunshine State Health Plan of not paying them like close to $1 million. That was over a year old. And they started paying them once Politico started calling ACA, which is the Florida Medicaid acronym. So they've paid a lot of it apparently now since this investigation started, but they are refusing to pay interest.
Well,
what are you gonna do?
One of the great plans for managing your costs is just to not pay your bills. That's fine. Super not
True.
cool.
Anyway, but we have some other drama. Like, isn't the same thing happening in Oklahoma? There's a bunch of providers like actually going out of business because and I think the state is blaming it on just like transitioning to managed care is hard. Oh, they actually aren't blaming it on Change Healthcare, which is exciting and
Blame
surprising.
it on Change Healthcare if I were them. I should have said
That would have been like, I don't know, the claims didn't go through.
Don't know how to pay. Don't know how to pay. Don't know how to pay. Well,
Ransom. Anyway, so whatever. And then this is just more about how health plans make money even when they don't make money. It's just like one of those things we've been talking about, Lisa. None of us really understand. Basically, like this is also, of course, from our world famous His Talk. A reader comment. There's another huge riff that's happened, and apparently there's one that was supposed to happen this week, but I could not find it on the internet. That doesn't mean much because Lisa is the one who actually finds things on the internet. But again, as you can see here, shares are up 18% in the past 12 months.
that's great. Yeah.
What business that loses money and makes money at the same time? Like that's what I want to know.
It's a mystery. It's truly a mystery.
Do you think it's because like it's my small lady brain? Like maybe I just like don't know how to do it yet. But I'll go figure it out. I'll go talk to some of these health plans. And then last, before we go over to our wonderful guests who are staying up very late European time for us, Central European time, we are throwing another interesting person dinner. It's going to be the day before the Health Data Palooza event. As you can see here, we have put the logo on here. Although Health Data Palooza is not paying us for this, so we get to make up our own rules. And the rule is you have to be registered for Health Data Palooza to actually get a confirmed seat at our dinner. They are big, but also small. We can only hold about 80 people. We usually sell out. And so if you want to come to this thing and meet interesting people, you have to kind of let us know that you exist so that we know to invite you. Otherwise, we're going to invite all the interesting people we already know. So check it out.
And you have to be prepared to make a donation to the Zoria Foundation to support women in healthcare. That's also part of the deal.
Especially if you're a government employee and you continue to come to these events and drink all my alcohol and complain about how you aren't allowed to take gifts and then never donate. I don't know, just saying, weird.
You gotta make it so freaking weird. Be ready to open up your digital wallet and make a donation to the Zoria.
Be prepared, not scared. Yes. All right. Okay. All right. We're going to move on.
We have some really good comments here from a best friend of the show, Ritesh Patel, including that South Florida is ground zero for Medicare fraud.
True. That is
he's right about
real.
that one.
Yeah. That is accurate. Also, Ritesh says, do not get an RSV and COVID vaccine at the same time. Lisa, what do you think about that?
Sounds like some bad experience. I have not gotten an RSV vaccine, so I cannot speak from my own perspective, but I believe Ritesh. Flu and COVID, however, you can do it. Just read it out.
Ritesh he's almost never wrong. So like, I feel like we should probably listen to him here. But again, this is not a real news show. This is not real media. We are not real reporters.
We're not doctors. We're not attorneys.
We are not doctors.
We sure are not qualified to give medical advice. All of the above.
Oh my God. All right. Time for some real guests. Hold on a second here. Okay. So we've got Julian and Sarah. Y'all, all of our million fans remember these two. We met them at Health Europe in Amsterdam. They told us amazing things. They presented some amazing study research report back then. And Julian, despite the fact that I posted on the internet, fill out this form if you want to be on my show, he just DM'd me. Let me be on your show. I want to talk about this report. But you know what? He kind of did an okay job last time. So here they are again. What's up, guys? What are you doing? What's happening? Are you in a cabin, Julian? Are you like hunting a lodge in Africa? What is going on?
No, I'm in someone else's house. It's an Alsatian house, or a house in Alsace. One of the originals. It's a very old.
There is a spear on the wall behind you.
Yeah, that's because these people who run the house used to live in Africa for many years and then brought back all sorts of paraphernalia from Africa, including this Kenyan spear.
Okay. Do you have any stuffed large cats in that house?
Uh-oh.
No, there's a roaming Labrador somewhere.
Oh, okay. All right.
She's
not stuffed.
No, she's not stuffed. She probably ate all the cats.
Oh, well, that's good. That's good. Well, this is Ritesh is watching you guys. So I think everybody knows, Ritesh actually introduced us to Sarah and Julian. So
He did.
he is here.
Hi,
He is
Ritesh.
here with us. We probably should just pull him on the show. But anyway, okay. So you
We
guys
should.
published a new report. And I think it was right when Rock Health came out, and you were like, "That one's wrong. Our report is right." And we were like, "Cool." So what happened?
Well, we published 4 reports. And that's
shit.
our usual 6 monthly diet. So Sarah's very busy every 6 months, leading the team through that. So yes, we publish a global report which looks at the entire spectrum of digital health across the planet. And then we spend some time diving into the US, into Europe, and to Asia Pacific. I guess the 3 key regions where most stuff happens. And so those 4 reports. So yes, I always have a fun time, I guess, looking at what many of the other reports is telling us around digital health, and always like to point out how, I guess, the size of the gap between being a specialist looking at digital health and not being a specialist. I guess I can come back to that in a little while, but let me certainly spend some time allowing Sarah to talk through one of those reports. And we thought, because of your audience, we'd sort of spend some time looking at the US data today as opposed to another region, so that it's actually relevant to the people here. Anyway,
we do have a global audience, as you may know. But yes, I think your plan is a good one.
We can come back. When the European audience is actually back at work, we can come back and do the European report. But everybody here's on holiday.
Oh, that's right. All y'all are out hunting big cats, right?
Correct.
On
Yes.
vacation.
Yeah. So we spent some time recently publishing a report looking at the US reports, the US ecosystem itself. So we thought we'd spend a bit of time looking at that, and certainly looking at beyond just who funded what, which of course is common parlance out there. Let me hand over to Sarah.
Bradley, we can go through the highlights if you want.
Yeah.
Tell us some stuff.
Yeah, that was the brief.
It was a good half for digital health. We finally had some positive news, which was really good, because before it's just been, since COVID, going down as far as funding goes, at least. Of course, partnerships are going up because nobody has any money, so they need to try and find partners in order to commercialize some of this stuff. But I mean, overall, the US or North America as a whole, which is 99.7% US, was 22% up, right? With a total of $10.5 billion of funding in the first half of the year. So that's really good. And that's comparing H1 last year to H1 this year, right? So it's good news, right? It's positive that at least there's some money coming back into this space. It's really venture capitalists. They were so slow last year, right? Everyone's afraid to invest in anything, not really knowing what was going to happen. And they finally this year started to open their wallets back up. And we saw actually quite a bit of an increase in Series C and beyond deals, right? Whereas last year it was all Series A. This year we saw the higher ticket size, later stage deals, right? So it was exciting, really good to see. What really was the focus, and what shocked me when I wrote the report, was that mental health came back onto the radar, right? That was all the COVID thing was mental health, telemedicine. Now all of a sudden mental health is coming back, which, I mean, the last 2 years, it's just been off the charts, off the bottom of the charts. So mental health was really big news. And of course, the other big item, the big gain, we could say, was in tech bio, right? Who's using all this Gen AI to do the pharma research, or at least to help support the research tools, right, for pharma companies. So that's where we really saw the spikes in funding, right? Perhaps a lot of that has to do with the AI hype, Gen AI hype that's been going on. Investors are still really excited about it. Whether that's good or bad, you guys can opine on that, I think. But that's really what we're seeing still going on. Right.
So I saw some of the charts in the and I think you had some slides that were online that were easy to access, and it did show that things are like looking better than 23, but I mean, previous years were like wild. So do you think we're going to see a return to that, or is it like, let's just be normal in the next few years?
I don't see anything getting wild again. That was COVID. That was all crazy. Non-traditional investors jumping in and saying, let's throw our money at something because there's no interest anywhere else. Right. That was crazy.
Yeah.
But I mean, you got a little hype growth going on, and now we're going to see a steady increase, right? It's healthcare now. You can't say it's digital health. It's healthcare. It's here to stay, and it's just going to slowly increase and keep going, I think, on a very positive trend.
Yeah, although
Okay.
I think we've got to be careful here. We got to be careful with this one. Certainly, you're right, Kat. We did see things go bananas up until 21, and then things started deflating from 22 onwards. Whilst it's great to see the investors coming back in to invest other people's money, we've got to be careful why they're doing this. And so, if you look at the data, a large share of new funding coming into the US digital ecosystem is going into AI. We would hypothesize at Gaining Growth that is investors looking for an opportunity to place their money in order to improve the IRR of their portfolio, which up until now is probably languishing a little bit. And therefore, you could accuse AI of becoming the crutch of VC as it limbers along at the moment in digital health. And it's masking, I think, what still remains quite a high level of stress in the digital health space at the moment. And you just mentioned the TruePill deal, for example, which another large organization raised a lot of money and does a merger with the desperate view of trying to carry on. Akili, we saw, will do the same thing, for example, and that will continue going forward. So the word as a note of caution from us, certainly, in terms of not getting overly excited. And we don't think this is a rebound. It's just a trend.
Yeah.
Okay.
I would say on that, like, I fully agree with your word of caution, because not a lot of that's going to result in meaningful, actual, real returns, as far as I'm concerned. From what we've seen, the level of froth doesn't necessarily produce great companies or great investments or great returns when you have so much froth. And there have been very few things in the marketplace that have been as frothy as AI, except for the dreaded blockchain back a few years ago, right? And like the actual results, right? And I'm saying dreaded blockchain. I know Michael is itching to join this conversation, and we'll give him a moment later because he loves the blockchain. But I do think that he does. But a lot of these AI investments are for sure vaporware at best.
Yeah, the question I have too is, you're saying there's more B and C rounds, but much like what we saw in 21, 22 with like, are those B and C rounds smaller than we've seen over the past few years? Or are they, on what we've been seeing?
Right. I have the data probably. On average, the deal size is coming back up.
Okay.
It is, but it's not. They're not on the level that they were in post-pandemic. Right. Those were
years. And that's driven by certainly a return of mega deals. So we've seen an uptick in mega deals, as in deals over 100 million in size in the US. So that is driving the average up, certainly.
Yeah. Okay. That makes sense. And then tell us about what do you think is going to happen with mental health? Because it was, people were saying oh, it's frothy. And then it kind of dropped a little bit, but I think it's been back up for a while. I don't think people have thought that that's going away. It definitely hasn't been in the policy world, but that doesn't mean in the real world it hasn't gone away or diminished slightly.
Well, one of the challenges with mental health is the development of evidence, right? It's much more challenged to actually get good, solid clinical evidence in mental health, just because your endpoints aren't very well defined, right? So as evidence is becoming more required or much more favored by investors, by health systems, by everyone, right? I think mental health has been a little bit behind, and they're finding ways to catch up, but that's one of their hurdles that they're having to deal with.
Yeah.
Yeah, Ritesh makes a good point there as well.
Yeah, I think when the largest purchaser of healthcare services and products decides to reimburse for something, things are good.
Right.
Yeah,
a lot of
but you're gonna need clinical evidence. So you're gonna need clinical evidence. So Sarah's point is very valid here. You know, it's
Right.
Yeah.
there's a
But some of the more
promise
successful
there, but we've
companies
got
at
to
the
back
moment
it
are
up.
finding ways to get the reimbursement, right? That's the key that they're finding is, okay, this is how we can actually get it to work.
Okay. Other than AI, which Lisa and I like love so much, and then mental health, what else do you think? Like, what's exciting? What other product categories are like super exciting for you guys?
Well, what's really exciting are, if you look at the partnerships, health systems in the US are just not skyrocketing, climbing steadily as far as the number of partnerships with digital health. So that's actually getting the solutions into the hospitals, into the health systems. But there you still see, and here's where kind of AI comes back into it, right? It's the health management systems. It's those IT backbones and all the solutions that plug into the IT systems in hospitals. Those are the ones that are really getting funding and getting the partnerships with the health systems. So it's kind of a different look on digital health. It's still what in our circle of digital health, our taxonomy, what we call is in, but it's a very specific part of digital health. And one of those, a bridge, right? One of the rising stars in that particular sector is a very good example.
Yeah, we'll get into this a little later probably, but one of the things that we heard and that we talked about a bit in our live show from Tuesday or Wednesday or whatever day it was this week is Epic referring to AI as a developer tool. Agree. And then also built into all of these administrative health management systems, Sarah, to build off what you were saying. And then also multiple physicians and physician leaders, unprompted, not coordinated, telling us that the thing that actually has made a difference in their actual work lives is the ambient listening, ambient charting.
Mm-hmm.
They're like, that's like, if you tossed everything else out, that's what's actually made a difference in my life and my ability to work and not have to have pajama time for like 10 hours in the evening. Truly that was
that was the central conversation for our breakout in Amsterdam, if you recall.
Mm-hmm.
With the health system.
Yeah, no, they're actually using it. They're actually getting value from it. It's not fake. It's not vaporware for them. That is real.
Yeah.
Mm-hmm. Yeah, and we did not stick to Epic's list of people we could interview. We picked up a lot of randos that we found, in the petting zoo and on the carriage rides and on the slides and stuff. And and while we were hanging out with the zebra, and they showed up, and Epic was like, okay, I guess this is happening.
All right.
And unprompted, right there, that we did, when we were in the big session, we were listening to all the rah-rah, and that was one of the slides that physicians are saying, holy crap, this is saving me so much time. Like, I'm never home for dinner. And then all these docs actually came on, and they were like, one of them, Dr. Patrick McGill, he practices just 1 day a week. He's the Chief Transformation Officer at Community Health Network in Indianapolis. And he's like, 1 day a week, the ambient AI tools are saving him hours, even only practicing 1 day a week. So you can't imagine, a whole, someone who's full-time clinical work, must be crazy. And the other thing we heard that was interesting about hospitals and AI is they're all setting up their kind of independent AI governing boards. And we tried to talk to a few people about how they did that. It sounds like everybody's just kind of like, I don't know, we got some smart people and we asked them some questions. And
trying to understand, they know that it's a risky area for them, and so they want to have some kind of governance model to help them assess what's going on. But they're like, it's just like them, it's one hospital, one health system. They're all trying to solve a similar problem at the same time, using the best information they have.
Right. Yeah, but I was talking to somebody here in Basel doing the same thing. He's now doing AI and programming for a hospital, the University Hospital here in Basel. And I'm like, but there are all these solutions already exist on the market, right? There are specialists, there are people who are really good at it doing them. Why are you guys developing your own?
I know, it's crazy.
Yeah.
Yeah.
I mean, I think you never know. It's a regulatory, it's a governance, it's a political, small p political thing. They just don't, it's scary probably, right? Like, could we be getting it? Or could we be doing something that could harm people? Do we have all the information we need? I think it's just truly a reaction to we don't know we don't know a lot about this yet. It's still new for us.
Mm-hmm.
That's my
mm-hmm. Yeah. The other thing that might be interesting, talking about your report and all these partnerships with hospitals and then bringing up the, so some of the interesting implementations with large health systems is, one of the things I think Lisa and I were talking about when we were at Epic is like, wow, like Epic makes a feature and it blows up a whole category, right? Like, and it is interesting that some of these technologies that are really useful to providers were actually their partners, right? So the ambient listening AI tool was from Nuance. My son is army crawling into my office, so we'll see what's going on. But they're from partner technology. So kind of interesting because, normally we all get freaked out and think that Epic's going to eat the world. But in this case, it actually was not their homegrown technology. So I don't know.
Mm-hmm.
Hopefully we'll see. This might be a space for like more hot shit startups to take over instead of just getting eaten up. So, someone's talking about blockchain in the comments. My favorite. Didn't we learn that the DAO or the markets are run on blockchain or something? I
was just kidding. Michael Marchant is going to tell us all about how amazing it is. I'm just being snarky. I'm being snarky mostly about the frothiness of the blockchain hype of yore and the AI hype of now. There is
that hype. 58% of all funding in this half went to AI ventures or ventures using AI. Like the hype is huge.
Wow.
So,
that's amazing. That's truly incredible.
Yeah, it's a lot.
Well, speaking of blockchain, my youngest child is actually mining Bitcoin. So I feel like I'm like doing the blockchain. I'm like totally here for it. So, we got to get rich somehow. It's good for them to know how to do stuff. So, okay. Other than, so what do you guys think? Because I know you do a ton of reports, right? That cover, the whole globe. So give us, because we do have like maybe 3 or 4 non-American fans. What's exciting going on globally?
Well, we're sitting in Europe. Europe is pretty much flat when it comes to funding deals, right? They're hanging out. But Europe is still very much focused on pharma, the tech bio, right? Pharma partnerships. There's a lot going on for different reasons. Socialized medicines hospitals aren't as free to do what they want. B, they don't have big tech partners pushing the Gen AI ticket. But Europe is very strong, especially in the highly regulated areas, and we saw most of the action there with pharma, having to do with pharma research solutions, tech bio, those types of areas itself. Asia Pacific actually also stayed flat, which is they were down a little bit, but it's little. Which is really exciting because they've been really nosediving for a while, right? China is still non-existent when it comes to digital health and funding going into digital health. So that was positive news in itself from Asia Pacific. So we like that. But here in Europe, there's a lot of positive things going on in the digital health space, and it always lags the US anyway. So we're looking forward to hopefully seeing that pull up. At least seeing some more positive signals coming like we've seen from the US.
Yeah.
Still the same fascination for AI over here in Europe. I mean, significant share of funding in Europe, despite the flatness, has gone into AI. I think mental health certainly has not seen the same surge that we've seen in the US. Here in Europe, still oncology is the favorite kid. They seem to recall, Sarah, something in relation to a slight anomaly in Europe around funding into patient solutions versus, say, the US.
They did with Sword Health being initially founded in Europe, right, in Portugal. There's still very much they brought the digital therapeutics portion back in, and anyhow, that's kind of the regulated space that we're talking about. Digital therapeutics in Europe is definitely still a topic. So digital therapeutics sits in patient solutions, and patient solutions was indeed the top cluster within Europe. But otherwise, otherwise Europe is staying quite strong, right? As far as the investors maintaining some strength, they've maintained better strength than the US. The US has caught back up. And let's see, and women's health was definitely on the ticket in Europe, being Julie, I think oncology was second. Actually, women's health came out on top in Europe this year, which is great.
Huh? Right on. That I don't think that's how it happened in the U.S., but like I don't know. We just got to the point where we're talking about how we can do more than give ibuprofen for IUD insertion. So we're over here like we're just like figuring stuff out over here. I don't know. So you guys, Lisa, did I interrupt you?
No.
No. Okay. So one of the reasons I think we got talking about your report is because you disagreed with some of the stuff going on in the Rock Health report. Do you want to tell us some of that, Drama Llama?
Yeah, of course. I mean, listen, both our organizations have a very long history in digital health. And certainly Rock Health, I think, was founded in 2010. So both have very strong reputation. There's difference in terms of the fact that our friends over Rock Health are US centric and focus on the US only, and therefore we're able to keep that focus on the US as well. So at the same time, relating it back to the rest of the globe and looking at the overall trends. But the difference really come from largely to the definition of digital health. So our taxonomy, our definition of digital health differs from theirs, and so we would regard our definition to be more comprehensive. But the other key driver for those differences is really what I would describe as core competencies. We have now been really for the last 10 years cataloging, tracking, verifying data, and built our own platform to achieve this. Our friends at Rock Health, have gone from being an accelerator and now really a consultancy. So different competencies lead to different outcomes. We love their reports, by the way. We read their blogs and with interest, because they always have a very good analytical esprit when it comes to looking at digital health and what's driving digital health. We just feel that they leave themselves short with the way in which they look at the breadth and depth of the digital health ecosystem, which then has an influence on the numbers. So I guess the answer to anyone who's doing any decision making in digital health is look at many sources as possible, but certainly make sure that you look at Sarah's and her team's great analysis.
Yeah, Sarah's smart, to our loyal fans. Well, one more question for you guys then. You said you've been around forever, right? For me, 2010's forever. That's a few US elections. So, often out here in the wild, a lot of us say like election years suck for business, right? Sucks for funding, sucks for a lot of things. I know you've only been around for a few elections in the US, but like maybe, have you seen that trend that it's just like there's uncertainty, people know what's going on, and so funding in most cases is a little bit drier than regular years?
Uncertainty.
Yeah.
So we at Galen Growth look at the data and track what we call funding stress in the system. We look at it at an ecosystem level, both geographic, at a category level. We look at it at a funding stage level, etc. So Sarah can say some more on that, particularly as you look at the level of stress as we've tracked it over the last few years and how the US is panning out. She's probably got the numbers to hand, which is why I'm letting her do that. And then we can talk about what we see in Europe. Because of course, Europe, we've had our fair share of elections as well, which of course has created its own volatility. And of course, we've got Ukraine on our doorstep to the east, etc. So we've got our fair share of bounciness, let's say, or volatility. I think the markets are getting good at pricing these things in. But let me hand over to Sarah in terms of what does the data look like in terms of that stress level. Anyway, over to you, Sarah. Sorry.
I mean, that's you guys are right. Coming into this year, we said it's an election year. You have so much conflict going on in the world, but so far, what we've seen is that the funding stress. What Julian said, it's improved over H1. Right now, we're reaching the second half of the year. Of course, the election gets a little bit more intense, but so far the signals haven't been as extreme as we thought they would be. So that my crystal ball isn't working at the moment. I can't tell you what it's going to be, but so far the signals aren't as bad as we thought.
Well, and you know, I think just today, Jerome Powell came out to say we're gonna have rate cuts, and so much of the
He
story
did,
of the
yes.
last couple of years has very much been the disappearance of cheap money, and not that we're going to go from 5.25 or 5.5 or whatever it is right now to 1 or close to 0 again, but you know, any kind of reduction of that pressure and the willingness for people to open their wallets or for funders to open their much bigger wallets would be interesting as well.
Yeah.
Yeah, I think you're right. I think that will be seen as a breath of fresh air, and the markets have been trying to predict that one. It's also fair to say that we're seeing, or we have witnessed in the last 12 to 18 months, a significant slowdown in sales cycle, decision making, timelines, etc., at a corporate level as well. So I think the whole, I would consider the whole healthcare system, most of its stakeholders, to be in a slower decision making mood presently than they were, you know, a good couple of years ago.
Yeah, totally.
Strong agree. All right. Well, we are going to shift over to our favorite unpaid correspondent here to give us a recap of his time in Verona, Wisconsin. But Sarah and Julian, anything else you want to leave our many loyal fans with, including our super fan, Ritesh Patel?
Yeah, you'll see. I know. I see him pop up. I need to say, well, thank you very much. The reports we'll be referring to are free of charge, so you can download them from our research page. So that's galengross.com/research. And Sarah is actively now with her team working on a full refresh of our annual analysis of clinical evidence in digital health, which, as we all know, is a massive proof point that is critical to any decision, whether you're partnering or whether you are wanting to invest in digital health. So watch the space,
awesome.
but that's due out at the end of September.
Absolutely.
Awesome.
Followed by AI report and then our annual Pharma Innovation Index, rating which pharma companies are actually doing what in digital health. How well are they doing it?
Oh my
Right.
gosh.
That's always fun.
A super report on AI. We will be sure to cover that.
We'll be covering
Awesome.
that.
Awesome. And
Thank you, guys.
I'll be sure to DM you.
Awesome.
Yeah, please do.
DM
Please do.
Kat. DM Kat.
Don't fill out the
Kat,
form.
for sure.
Obviously.
No, Julian, don't
do
listen
that.
to what you're
yeah,
doing.
whatever. Oh my God. Okay.
Okay.
All right. Well, you two.
Talk soon.
Thanks for having us on the show.
Thanks for joining us so late. Thanks for telling us the stuff. And we will see you soon. And we will be back on here to roast each other on AI. So thanks to you guys. And
Thanks.
moving. Oh, I just cut them off. Anyway, well, we love them. They're great. They'll be back. Michael.
Why are we roasting?
Yeah,
your first
people on
words
everything.
the podcast today sound like, "Hello, everybody." Did you have a long night last night? What was going on?
I'm still recovering from my time in Wisconsin. Yeah, it was kind of a rough night. It's kind of, every night's rough.
Yeah. I mean, you got.
I look great. Thank you for saying that.
You got Lisa sprinting through the airport to try to catch her flight.
Lisa always makes her flights.
Listen, I got the closest I've gotten to missing both of my flights, and it was rough. And it was. I do not miss that. I don't miss the days of being cutting it real close, scooching back in. These days when you fly, you need to be right in there so you can get space for your overhead stuff, or else
Totally
it's not going to
agree.
make it on the plane. That's the thing.
100% agree. That's, they call us gate lice, all of us people in zones 2
That's
and
me.
whatever, that like, we're like, oh shit, we got to get on this plane. People don't realize, like, it is a bitch when you can't get your overhead space. Like, you got to really get on there.
Maybe that's a theme for a future, health tech talk show. Getting all the travel people with all
Gate
the
lice.
tips and
Gate
tricks.
lice.
Gate
Hopefully
lice,
not
sorry.
real lice.
Sorry.
No real
Yeah.
lice, only gate
Yeah,
lice.
my daughter
Yeah.
had lice in like 4th grade, and she goes to the school. Principal calls my wife. My wife tries to talk to my daughter, and she's just sobbing on the phone and not knowing what's going on. And so my wife drives over to the school to get her, thinking something tragic, because she couldn't get the words out of what was wrong. So something tragic happened, and then she just had lice, and so we left. And then
Yeah.
she had oily hair for like a week. So
Yeah. Not great. I am a little raspy today. I wonder if it's because I got the Rona when I was traveling this week, but we won't know that because the government hasn't given me those free tests. So we won't know. We won't know what's happening.
You got the Rona in Verona. See, look at that.
Maybe. Like
Maybe you
I
got
said,
it from one of the
we're
goats.
gonna
Matt.
find out. Well, I feel like didn't they say it can jump from cats to humans, or is it dogs?
I don't think
Anyway,
it's
point
Not
is,
Dr. Fauci, don't ask me. Okay.
this is not a medical advice show. Just to repeat that, this is not.
Not even close.
No, if I got the Rona, I'm pretty sure I probably got it from the 10,000 attendees to the Epic.
It was
UGM.
more than 10,000, Cat. They just have to have shoved 10,000 into one room. I think
There were tons of overflow rooms, Kat. There were the whole thing was overflow.
With vendors and Epic staff, it was probably 13, maybe 15. I don't know they ever publish official numbers, but if you walked out of that general session on Tuesday morning, there were more than 10,000 people there for sure.
Yeah.
Well, I'm not good at numbers, but I was impressed with how they fed all of us.
Yeah,
that was pretty great.
They do a good job with that, in and out with the boxes and the lines and all that good stuff. So, I mean, you were super impressed by what happened on Tuesday afternoon at the tent with all the. Did you share your picture with the bear from inside the food tent?
I have not yet shared that, but it was me looking very overwhelmed. Because y'all, here's the thing. When we were told this was a nerd show, we were like kind of excited. And then I realized like my definition of nerd is different than Epic's version of nerd. Yeah.
Really?
Yeah.
Would you like to share?
And I was a little.
Go ahead, Lee.
I was just gonna say, I think the loyal watchers of this show should understand that I've been in healthcare IT in various shapes, sizes for more than a decade. Michael probably a little bit longer. Kat probably around the same time. I've seen a fair amount in this industry, and I think without having worked at or directly with Epic, I didn't truly understand the scale, having never been to their what was it? Global? No, it's
User
their
Is this
no the intergalactic
Executive?
headquarters. Sorry,
Yeah.
the intergalactic headquarters of Epic.
Yeah. There's a sign that actually says "Welcome."
And that's
to
what
the
it says, intergalactic headquarters.
Along with
And
It's real.
it's real, and it's a lot of people. It's a massive campus. They have a huge number of employees, and they have a massive number of customers. And I think just the scale for me was a bit shocking to experience in person, how big it is. And, truly a very different culture than you could imagine another software company having. Because one of the great points was made by a new friend and hopefully new friend and new guest of the show soon, as soon as he gets his PR.
He's not authorized.
Clear, not authorized yet. Is that Epic is a software company, just like Oracle, just like all these other companies. It's a software company. They have big ambitions and they have a lot of reach, but they're a software company. And so the things they put out there, some of them are real, some of them are not. That's just how software companies work. So it was good to kind of get both sides, where me being kind of like, whoa, and then someone saying like, remember, what a software company is. Like, they also don't mean everything they say and do everything they mean. And, things work and things don't work. And that's how software works. So kind of saw two sides of it, but it was very overwhelming for me personally.
Yeah, I mean, if you were at the HIMSS in August in Vegas, and you were traversing through one of the buildings, has like this super thin hallway, and when you switch sessions, it's like you can't. If people are going one way, you can't go the other. Just imagine yourself there in Vegas in one of those hallways, and just not being able to move. I mean, coming out of general session was like that, and they've spread them out. I think, what did Judy say? They have a 17,000 acre campus there, and they're building buildings. They continue to build buildings because people are most creative when they have space. So every employee at some point will have an office. That's their goal. And I think somebody said, they're north of 10,000 employees as well. And their policy is to have them in Verona unless they're at a remote intergalactic site in like Europe or some other place. So, so if you like to work for Epic, move to Verona or some other of their intergalactic way stations. So
Well, they're also present in now what is like 15, 20 countries. That was also news to me, the level of that. Like I didn't know how far that had gone. Obviously Cerner, well, Oracle has a presence and has had a presence in other countries for a long time and is bigger. We also have a number of other, software EHR like companies that have, coverage in various other countries and systems. But to see how much their global presence has grown as well, that was also somewhat news for me. Not because I shouldn't have known it, just because I didn't know it. So there you go.
Yeah.
Yeah.
It is overwhelming. If you haven't experienced it, if I had my badge in front of me, I mean, I've been to 20 events on their campus over the last 30 years and doing this stuff, and it just continues to grow. Again, they're a software company and they've done something right. And I'm surprised there's not a book on the Epic way and letting people know some of the secret sauce. And if you'd like to contact me, I'll give you my opinion on the secret sauce. I think that's really where holding your customers accountable, deploying software that then you say, this is how you use it. And if you don't use it that way, we'll charge you more, which are two factors in the special sauce. But just like the McDonald's recipe for their Big Mac sauce or Chick-fil-A and their fry sauce, I'm not giving you the rest of the recipe. But wait,
can you say? I think people might not know what you're talking about right there, because that's an important one. You said if your customers don't use your software to its full extent, you get charged more. Say more about the stars and the jib jabs and all the things.
Yeah. So Epic has
Diamonds.
a program. Kat, you've been jumping. Do you want to jump in before I describe gold stars?
No, I would love to hear about the gold stars and the diamonds.
It's not Goldfinger, and there's no mini-me. But if you deploy so basically what Epic does is each of their many modules, they have best practices and essentially functionality that they have you turn on or not turn on. And based on the factors, and let's just pretend I'll pick a module like Beaker, which is the lab module, right? In Beaker, there may be 72 functions. And to get a star for Beaker, and this is not exactly the way the scoring system works, but just for an example, to get a star for Beaker of one of your 10 stars, you need to have 90% of the capabilities that they have deployed within Beaker turned on. And if you don't have 90% of them, you don't get a star for Beaker. Now, the scoring system works a little different than that, but each module has functionality that you turn on or off. And Epic will tell you the best practice is to turn all of them on. Most organizations choose to turn a majority of them on. But I think that part of their process here is that, when I went through the EHR incentive programs and practices were putting in EHRs to get access to those incentive dollars, and that was a big motivator, they were essentially just taking their paper processes and stuffing them in the technology to get access to those funds. Realistically, when you deploy new technology, you need to take advantage of what are the workflows, what are the processes, the automation that you can actually embed in your work to make your work easier. You talked earlier about Ambient. We've also seen Ambient has saved time for our providers. And I think that there's going to be more and more instantiation of where ambient voice, where you're talking to your computer and your patient, the computer pulls up, creates that text. So the prompt is just the voice recording talking to the patient, and then submit your prompt to your AI, and then it'll spit back a note that the provider can review. I mean, I think we've all done that. We've put prompt in ChatGPT or Gemini or whatever your AI tool of choice is, and it spits back a summary, and then you work from there as opposed to the mental energy to create it from scratch. And I think as the AI gets more complex and is able to integrate more workflows, ordering pharmacy, ordering tests, all the other more discrete activities within the EHR will become enabled, and again take away that burden from the providers or the folks using those systems. They always talk about operating at the top of your license. Well, when you talk about that, most of the people are talking about providers and nurses and caregivers.
Yeah.
But realistically, organizationally, from a dollars and cents standpoint, is you want every human in your organization operating like a human.
Totally.
And there are so many things that are robot, right, that we can automate and leverage technology to take that mental burden off so that people are actually engaged, challenged in their work, and not just keying stuff into a keyboard because they need to stuff it in the HR. So.
Well, that's not even robot though, Michael. There's so much administrative work that all of us, like weird, desk jockeys do because the systems are just not integrated correctly or whatever, or we
Yeah.
don't know how necessarily, like, you know, like I know how to do some moderate, you know, Excel programming, but, you know, I'm sure technically I could make it even faster or better, but like, you know, whatever, I'm not going to do that. Right. I'm going to copy and paste the value into that.
Hey, Lisa, there was a company that recently went out of business that their whole thing was doing macros and keyboard mapping and running those things. So you can automate
Right.
anything, but the question is it robust? Does it error tolerant? Is it fault tolerant? Does it do what you need it to do? And can it morph as you move forward? And I think that, you know, we use AI for everything. There's lots of different aspects. Actually, they even highlighted in the general session that some of the types of AI. So when you hear AI, you really have to ask the question is, what is the AI doing? Ambient voice AI is generating text notes from your voice. There's imaging AI, there's predictive AI. And I think that that's where, as consumers of technology, we need to be intelligent, ask the right questions, and make sure we're using the right technologies for the right purpose. I gave a presentation to a room full of folks talking about TEFCA and QHINs, but one of the things I talked about was using the right tool for the job. V2HL7 is a very fine tool, for those of you familiar with it, that generates data out of your EHR, your system, when you finish a workflow. It doesn't do the same thing as FHIR APIs, which is a request and respond. It doesn't do the same thing as CCDs, or back to your earlier point, blockchain. Blockchain does things really well, like consent or smart contracts, which we talked about when those drinks with the cloud of smoke got served. But I think that that's where you want to make sure that what tool you're using is the right tool and be educated on it. And I think that that's where a lot of things, back to even EHR incentive, is you don't want to do things quick, dirty, and make it fast. You want to implement to the nth degree. And back to Gold Stars, Epic holds their customers accountable to operating at the nth degree. And I would encourage other software vendors in the market to know what your customers are doing, make sure you're measuring it, have a best practice, and then work with your customers to help implement that across your ecosystem. So,
yeah, and something I know we're mostly out of time here, but something I'll say about Epic is that you know, I know a lot of people dislike Epic strongly in the market, right? And a lot of what we've heard from Epic people are like, hey, you know, yeah, we want to engage more with the outside universe, but if you're inside Epic, you're an Epic customer, like it's very engaging. Like you are constantly being engaged, you're being taken care of. We have an incredible account management team, all that. And like, I will say, like, I have never seen anything like it before. Being
Never.
at that user group
Personally,
meeting,
never.
the
Never.
investment in account management, implementation services. I mean, I would say that's the secret sauce right there. It was incredible how well they took care of me and Lisa. And we're not customers, right?
with
Like
your red badges.
it was very
for
impressive.
sure.
Yeah, with the red, yeah, we had red badges. It was like a no-go, but yeah.
There was
Yeah,
one more thing which was said in the public session, and so I can say it here because we were given no rules like that.
No rules, that's right, Lisa.
No rules.
No rules.
And it was that, you know, yes, there's just turning on the features, but there was a comment about that Judy Faulkner made about my chart and how in the future they're going to change the way that they calculate the stars, the diamonds, or whatever, to say like, no, you also have to show a certain level of meaningful use, to use that, that you're not going to, turning it on is not enough. You've got to actually show a certain level of engagement and use. So, you know, I mean, that's the implementation game. It's really hard.
For sure. And and having the power, or whatever you want to call it, to make your customers do something that you think is best practice. And if you don't do it, there's some penalty, financial or otherwise. That's a big deal. And to Kat's point, I'm in transition between UC Davis and Sutter, and I think I met with like 7 or 8 different account people tied to the Sutter account, just getting spun up on the things going on. So you're right. I mean, there is a lot of relationship, a lot of hand holding, a lot of customer touch that also drives some of those things too.
Yeah, yeah. Well, dear fans, we are out of time, and we want a special thank you to a very unpaid correspondent moving over to his new job at Sutter, which I'm sure we'll talk about at some point. Yeah, amazing. So congratulations, Michael.
Thank you.
Basically, president of Sutter, as far as I know. Can't totally remember. But also thank you for chaperoning us and holding our hands and making sure. Making sure that when I did look terribly overwhelmed and had like thank you for photo documenting all those experiences for us.
Yeah.
You're the best.
Yes, your personal Uber driver is here for you anytime, Pat.
Amazing.
Fantastic. All right. Have a good night, y'all.
Thanks,
Happy
everybody.
weekend.
Have a